Hello student. Today topic of lecture, the heart. Next question. Overview of the vascular system and the heart. Right atrium and ventricle, left atrium and ventricle, the heart wall and pericardium, cardiac skeleton and heart valves, coronary blood vessels, cardiac veins. The vascular system consists of the network of tubes or canal through which the body's fluids, blood and lymph circulate. The vascular system, on the one hand, supplies the cells and tissue of the body with necessary nutrients, and on the other hand, removes and transport waste product produced by the vital activity of the cells to the kidneys, the excretory organs. The vascular system of man and other vertebrates can be classified into two systems according to the character of circulating fluid. The blood vascular system made up of tubes, the arteries, veins and heart, through which the blood circulates. The lymphatic system made up of tubes along which lymph, a colorless fluid flows. This is blood vascular system, this is lymphatic system. The blood vascular system consists of central organ, the heart, and tubes of various caliber connected to it, which are called blood vessels. The rhythmic contraction of heart continuously propel of entire mass of blood contained in the vessels. In clinical practice, the blood vascular system is called the cardiovascular system. Cardiovascular system. The heart drives the blood circulation, which can be divided into small circulation, pulmonary circulation, and large circulation, systemic circulation. The circulation serves to transport blood and distribute it through the body. Its functions are identical to those of the blood. The most important function of the cardiovascular system are oxygen and nutrient supply of the organism, transport of respiratory gases and nutrients, respectively metabolism and products. Thermal regulation, heart transfer in blood. Defense function, transport of immune cells and antibodies. hormonal control, transport of hormones, hemostasis, transport of blood platelets, and coagulation factors. As you see, cardiovascular perform many functions. Both circulations form a closed system with the heart of the center functioning and as a muscular suction and pressure pump as a driving force. The heart is responsible for continuous blood circulation and beats at an average of 70 times per minute. This allows blood low in oxygen from the systemic circulation to first reach the right atrium and then right ventricle. Atrium and then right ventricle via the vena cava inferior and vena cava superior. From there, blood is pumped into pulmonary circulation via the truncus pulmonaris and enriched with oxygen. Saturated with oxygen, it flows through the vein pulmonalis 4 back into the left atrium and from there via the left ventricle and aorta back into systemic circulation. The heart core is cone-shaped, four-chambered muscular hollow organ. The size is roughly equivalent to first of respective person and the weight is on average 250 and 300 and other. In women 230, 280. The heart is divided into left and right half by the cardiac septum. The two halves of heart are each divided into right and left atrium dextrum and sinistrum, as well as right ventricle, ventriculus dexter and ventriculus sinistra. The atria have blind ending appendages known as auricles, auricula dextra and auricula sinistra. The heart is absolutely essential for life as the superordinate organ of the cardiovascular system. Its significance in medicine can, amongst other things, the recognized in that in addition to general practitioners and primary care physician, multiple disciplines such as cardiologists and cardiac surgeons have specialized in heart disease. What you see heart. This is heart has 4 chambers. This is, you'll see right. This is right atrium, left atrium, right ventricle, and left ventricle, aorta. This is aorta and pulmonary trunk. Pulmonary trunk, aorta, right atrium and left and ventricle, right and left. This vena cava inferior, vena cava superior, pulmonary vein. The heart lies in thorax, posterior to the sternum, and costal cartilage, and rests on the superior surface of the diaphragm. It is the largest organ in the mediastinum, which is the region between the 2 lungs and pleural cavities. 2 lung. This is right lung and left. This is posterior. Lung. There assumes an oblique position in the thorax with its point apex lying to left of the midline and anterior to the rest of the heart. Cone-shaped objects have a base. This is base as well as an apex, and the heart's base is broad posterior surface. It's heart. This is apex and base. This is lung. This diaphragm. What do you see? This is pericardium cut. This is lung. If you press your fingers between the fifth and sixth ribs, just inferior to the left nipple, you may feel the beating of your heart, where the apex contacts the thoracic wall. The heart has 4 corners, defined by 4 points projected onto the anterior thoracic wall. The second rib The second rib is easily palpated just lateral to sternal angle. Use this landmark to help you locate the four corners of the heart. The superior right point lies where the costal cartilage of the third ribs joins the sternum. This is superior right point. The superior left point lies where the costal cartilage of the second rib. A finger's breadth lateral the sternum. This is superior left point. Next, the inferior right point lies where the costal cartilage of the six ribs, fingers, breadth lateral the sternum. In next point, the inferior left point, the apex point, lies in the fifth in the intercostal space at the mid-clavicular line. Superior right point, superior left point, inferior right point, inferior left point. The imaginary lines that connects these four corner points delineate the normal size and location of the heart. Clinicians must know these normal landmarks because enlarged and displaced heart as viewed on the X-ray or other medical image can indicate heart disease or other disease conditions. Based on the relative position, various surface of the heart may be distinguished. Fasces sternocostalis, ventral location and mostly formed by the right ventricle. Fasces diaphragmatica, underside, lying on the diaphragm, consisting of parts of the right and left ventricle. The fasces diaphragmatica corresponds to the clinical posterior wall. Fasces pulmonalis, dextra and sinistra, adjacent to the pleural cavities on each side. On the right, it's formed by the right atrium. On the left, by the left atrium and ventricle. Heart has fasces sternocostalis, fasces diaphragmatica, and fasces pulmonalis, dextra and sinistra. At the ventral fasces sternocostalis, the location of the interventricular septum interventriculare, at the sulcus interventricularis anterior. Sulcus interventricularis anterior can be observed through which rami interventricularis anterior of the arteria coronaria sinistra runs. This is sulcus interventricularis anterior is located between right ventricle and left ventricle. On the bottom side fasces diaphragmatica. This limit corresponds to the sulcus interventricularis posterior with the rami interventricularis posterior. The distinction between atria and ventricle is formed by sulcus coronarius. Sulcus coronarius. This is anterior surface. This is what sulcus coronarius. And what sulcus coronarius. This is posterior aspect, through which, among other, the arteria coronaria dextra and sinus coronarius run. Sulcus coronarius. Sulcus coronarius. Sulcus interventricularis anterior with rami interventricularis anterior and sulcus interventricularis posterior with rami anteroventricularis posterior. Это truncus pulmonalis, aorta, auricle right, auricle left. This is left atrium, right atrium, vena cava, opening vena cava inferior, opening vena cava inferior. What you see here, this is heart. Is divided to half, right half, left half. This is, you see, right atrium, left atrium, atrium, right. This is right ventricle, and left ventricle. Pulmonary trunk and aorta, inferior vena cava, superior vena cava. This is aorta. This is pulmonary veins left, pulmonary veins right. Right atrium, atrium dextrum. This is, you see, cut the musculus pectinalis, cut of the auricle right. The atrium right, atrium dextrum, receive blood via 3 veins. Superior vena cava, you see opening, superior vena cava, inferior vena cava, and the coronary sinus. Externally, the right auricle, a small flap shaped like a dog's ear, project anteriorly from the superior corner of the atrium. What you see? This is auricle, and auricle. Internally, the right atrium has two parts: smooth walled posterior part and anterior part lined by horizontal ridge called the pectinate muscles. Musculus pectineus. These two parts of the separated by a large C-shaped ridge called the crista terminalis. What you see, crista terminalis. A landmark in locating the sites where veins enter the right atrium. This is crista terminalis, opening vena cava superior, opening vena cava inferior. This is crista terminalis. Right auricle. These two parts of the separated by a large C-shaped ridge called the crista terminalis. The superior vena cava opens into the atrium just posterior to the superior band of the crista. The inferior vena cava opens into the atrium just posterior to the inferior band of the crista. The coronary sinus opens into the atrium just anterior to the inferior end of the crista. This is you see. Opening vena cava superior, opening vena cava inferior, and opening coronary sinus. Coronary sinus. What you see? What sinus? Sorry. What coronaris? What on coronaris? Sorry. Ostium, sinus coronary. It is fossa ovalis. What's ostium, sinus coronary? Opening vena cava superior, opening vena cava inferior, and opening sinus coronarius. Just posterior to this end of the crista in fossa ovalis. What you see, fossa ovalis. A depression in the internal septum that marks the spot where an opening existing in the fetal heart, foramen ovale. Inferiorly and anteriorly, the right atrium opens into the right ventricle through the tricuspid valve, right atrioventricular valve. What you see, opening of superior vena cava and opening of inferior vena cava, opening of coronary sinus. This is opening tricuspid valve. This is musculus pectinate, and this is smooth surface of atrium atrium dextra, atrium dextra. This is auricle right. This is atrium right. And you see right ventricle. This not cut open. Right ventricle. The right ventricle forms most of the anterior surface of the heart. It receives blood from the right atrium and pumps it into pulmonary circuit via is artery called pulmonary trunk. What you see, pulmonary tract, ventricle right, right ventricle, right ventricle, pulmonary trunk. Right ventricle. This is left. This is sulcus interventricularis anterior. Internally, the ventricular wall are marked by irregular ridges of the muscles called trabeculum canea. Additionally, cone-shaped papillary muscles. Project from the wall into ventricular cavity. Thin, strong bands called chorda tendinea. The heart string projects superiorly from the papilla muscle. Muscles to the flaps, cusps of the tricuspid right atrioventricular and tricuspid valve. Superiorly, the opening between the right ventricle and superiorly the opening between the right ventricle and the pulmonary trunk contains the pulmonary Semolina valve. This is tricuspid valve between right atrium and ventricle and superiorly opening of the pulmonary trunk. What do you see? This is tricuspid valve, chorda tendinea, papillary muscle, musculus papillaris, and pulmonary valve. This is pulmonary trunk. This is right auricle. This is left ventricle. Left atrium. This left auricle. The left atrium make up most of the heart's posterior surface or base. It receives oxygen-rich blood returning from the lung through the two right and two left pulmonary veins. The only part of the left atrium visible anteriorly is triangular left auricle. This is what you see, sulcus interventricularis posterior. This is left ventricle. Left ventricle. What you see, coronary sinus located in sulcus coronarius. Internally, most of the atrial wall is smooth with pectinate muscle lining the auricle only. The left atrium opens into the left ventricle through the mitral valve. Left atrioventricular valve. Left atrioventricular valve. What you see, pulmonary vein. Pulmonary vein. This is right and left. This is cut of heart. Cut the heart. Left ventricle. The left ventricle forms the apex of the heart and dominates the heart's inferior surface. It pumps blood into the systemic circuit. What you see, aorta and semilina valves. Chorda tendineus and musculus papillaris. Superiorly of the left ventricle opens into the stem artery. Of the systemic circulation, what you see, aorta. Through the aortic semilina valve or simply aortic valve. What do you see, left ventricle? Left ventricle. This is, you see, this is left atrium, this is aorta, mitral valve, and muscles papillary posterior. This is muscle papillary anterior. This posterior, anterior tendinosis, chorda tendinosis. Heart wall and pericardium. Heart wall. The heart wall consists of the three layers: endocardium, myocardium, and epicardium. This is wall. Endocardium. Inner surface, which is made up of endothelial cells. And connective tissue. Cuspid and semilina valves are duplicate of the endocardium. Myocardium. Cardiac muscles consist of individual cardiomyocytes. The fiber bundles run in diagonal, circular, and longitudinal line, which enable concentric contraction and longitudinal shortening of the longitudinal axis. In atria and right ventricle, there is dual-layered structure. In the left ventricle, the myocardium is made up of three layers. In the area of the apex of the heart, the muscles form a vortex. What do you see? Vortex. Apex of the heart. This is left ventricle. Left ventricle. Sulcus interventricularis posterior. Coronary sulcus coronarius. This is right ventriculus. This is left atrium. This is right atrium. Pulmonary vein. Next, epicardium, lamina visceralis pericardi. The epicardium consists of single layer of epithelium as well as connective and adipose tissue. The adipose tissue contains the blood vessels and nerves of the heart. The epicardium corresponds to the lamina visceralis of the pericardium serosum and is their part of heart sac. What you see? Epicardium. This is vessels and adipose tissue. Pericardium. What you see? Pericardium. The pericardium with volume of 1,100 milliliter, including the heart serves to aid low friction contraction of the heart and gives easy stability. The heart sac consists of pericardium fibrosum. This is outside close-fitting connective tissue and pericardium serosum inside serous membrane tunica serosa. The section of pericardium directly inside the pericardium fibrosum is referred to as the periparietal sheet lamina parietalis. These fold over the large blood vessels aorta, truncus pulmonaris, vena cava inferior. On the front side to form the visceral sheet lamina visceralis. The visceral sheet corresponds to the epicardium or the heart wall at the weak point of the heart muscles, especially the lamina parietalis, is very strong. The pericardium is fixed at 3 points. Centrum tendineum of the diaphragm. There is broadly adheres. Posterior side of the sternum, centrum tendineus. This is posterior side of the sternum via the ligamentum sternopericardiaca. Bifurcatia trachea via the membrana bronchopericardiaca. Three points: centrum tendineum of the diaphragm and ligamentum sternopericardiaca, posterior side of the sternum, and bifurcatia trachea via the membrana bronchopericardiaca. Cardiac skeleton and heart valves. The atria and ventricle are separated by close-fitting collagen-based connective tissue, known as cardiac skeleton. The function of cardiac skeleton is to isolate the atrial and ventricular muscles and to stabilize the heart valves. This forms the fibrous ring around the four heart valves because they are all on the same plane, which corresponds to the sulcus coronarius. On the outside, this level is also referred to as the valve level. The tricuspid valve lies in the annulus fibrosus dexter. The mitral valve lies in the annulus fibrosus sinister. Aortic and pulmonary valves are surrounded by the aortic and the pulmonary ring. The aortic ring is connected via the tendon infundibuli with the fibrous ring of the truncus pulmonale. At two triangular points, the cardiac skeleton is slightly wide, trigonum fibrosum sinistrum, trigonum fibrosum dextrum. This is two triangular point, the cardiac skeleton. Heart valves. The heart valves are essential for the directional blood flow in the heart. A distinction is made between two types of valves. Atrioventricular valves. Valve atrioventricularis is located between atria and ventricles. Tricuspid valve. Valve atrioventricularis dextra between the right atrium and right ventricle. Bicuspid mitral valve. Valva atrioventricularis sinistra between the left atrium and left ventricle. Semilina valve. Valve semilunaris between ventricles and large vessels. Pulmonary valve. Valva trunci pulmonalis at the function of the right ventricle to the truncus pulmonalis. Aortic valve. Valva aortae, the transition from the left ventricle into the aorta. Valve. Three valve. 2 and 3 valve. This is, you see, fibroskeleton. Tricuspid valve has 3 cusps them. Cuspis anterior, cuspis posterior, and cuspis septalis. Bicuspid mitral valve. Valva atrioventricularis sinistra. Cuspis anterior and cuspis posterior. Next, pulmonary valve. Valva trunci pulmonalis. Valvula semilunaris dextra. Valvula semilunaris anterior. Valvula semilunaris sinistra. 3 valves. And aorta. Aortic valve. Valva aortae. Has 3 pocket-like cusps shaped roughly like crescent moons. valvula semilunaris dextra, valvula semilunaris sinistra, and valvula semilunaris posterior. And valves of the heart, superior aspect. This is pulmonic valve pulmonari, truncus pulmonaris. This is aorta, valves of the aorta. And you see tricuspid valve and bicuspid valve. This is aorta, pulmonary trunk, and this is bicuspid valve. Bicuspid. This is tricuspid. The atrioventricular valve are closed during systole, when the myocardium of the ventricle contracts and prevents return flow of blood to the atrium. The bases of the cusps are adhered to the fibrous ring of the cardiac skeleton. The cusps are connected to the papilla muscles via tendinosis et chorda tendinea by contraction of the muscles during systole. Inversion of the cusps into the atrium is prevented. During diastole, at a filling phase, the atrioventricular valves open. What you see, this is chorda tendineus, and you see what tendineus musculus papillaris anterior and musculus papillaris posterior, and located in left ventricle. This is, you see, right ventricle. This is chorda tendineus, musculus papillaris anterior, musculus papillaris posterior. Musculus papillaris, or papillary muscles, you see chorda tendinosus, musculus papillaris anterior, musculus papillaris in left ventricle, musculus papillaris posterior, musculus papillaris anterior. What you see, interventricular septum. This is intraventricular septum. What muscles papillaris anterior, what you see, septal, musculus papillaris septalis. This is left. This is aorta. This is pulmonary trunks. This is right atrium and right ventricle. This left, this right ventricle. Left, right. Semilina valves are located at the transition from the ventricle to the major vessels, truncus pulmonalis and aorta. The pulmonary and aortic valves each consist of 3 semilina valves. On their free edges, lunae, a small central signet, areas noduli cells the valve completely when closed. The valves open in response to the pumping action of the ventricles and close again when the blood flow back, when the pressure in the circulation rises above the pressure in the ventricle. Coronary blood vessels. The coronary blood vessels are the vasa private of the heart and ensure the heart's own supply. There are 2 coronary arteries, artery coronary right and artery coronary left. The coronary arteries are functional terminal arteries. Both coronary arteries originate from the ascending aorta above the aortic valve. What you see, this is enter. You see aorta, arteria coronaria dextra, and arteria coronaria sinistra. This is short, this is longer. Aorta. Arteria coronaria dextra and sinistra. The coronary dextra originate from the right sinus aorta, runs through the sulcus coronarius along the right atrium to the lower edge of the heart, extend across the underside fasces diaphragmatica, where it usually ends in rami ventricularis at rami interventricularis, posterior as a terminal branch. The coronary dextra supply parts of the underside of the left ventricle, the right atrium and right ventricle, as well as of the conduction system. Not coronary dextra, this is along and in rami interventricularis posterior. What you see, rami coronarius, or arteria coronarius right, not right, and coronarius left. Interventricularis, what you see, anterior ventricularis. What you see, branches of the arteria coronaria dextra, branches at rami coni anteriosi runs to the conus anteriosi, rami nodi sinoatrialis, and the next rami atrialis and rami atrioventricularis at small branches for the atrium and ventricle, and rami marginalis dexter stretches along the margo dexter of the right ventricle, rami posterolaterales and rami nodi anteroventricularis, interventricularis posterior. Many branches. The arteria coronaria sinistra issues from the left aortic valve sinus. After only 1 centimeter, it divided into the rami interventricularis anterior and rami circumflexa. The rami interventricularis anterior runs forward through the sulcus interventricularis anterior above the septum interventriculare of the fasces sternocastalis, and issuing as the major branch rami lateralis. Along its trajectory, the rami circumflexa flexus run through the sulcus coronarius around the left margin of the heart to the back, and normally issue of the rami posterior ventriculus sinistra. To see what normally, arteria coronaria sinistra supplies the left atrium, left ventricle, the anterior 2/3 of the ventricular septum, and portion of the right from ventricular wall. Note you see table with branches of coronaria sinistra. This is more important vessels. Rami coronaria sinistra, circumflexa, and interventricularis anterior, and branches, many branches. Veins of the heart, cardiac veins, which carry deoxygenated blood from the heart wall into the right atrium. The venous drainage of the heart occurs via three venous systems: coronary sinus system, transmural system, endomural system. Two-thirds of the venous blood are taken up the sinus coronarius, and drained through the ostium sinus coronarius into the right atrium. The main veins lead to the sinus coronarius. What you see, sinus coronarius? Sinus coronarius. The great cardiac, magnum, corresponds to the supply area of the arteria coronaria. What arteria coronaria correspond? The middle cardiac vein, vena cardiac media, runs around rami arteria interventricularis posterior, and vena cardiac parva. Vena cardiac parva is small vessels which drains the rest of supply area of the arteria coronaria dextra. Arteria coronaria dextra, but it is only present in 50% of case. The final third of the venous blood reach the atria and ventricles directly via the transmural and endomural system. This vena cardiac magna, vena ventriculi dextra anteriorly, and cardiaca parva. This is marginalis dextra and drain into sinus coronarius. We see a short table with information about cardiac veins. This is main vessel sinus coronarius system. This vein drain into sinus coronarius system. And transmural system include two group veins, vena ventriculi dextra anterioris and venous atrialis, and endomural system. This is include vena cardiaca minima, то есть vasa zebezi. What you see picture with artery and vein, and for example, what you see, middle cardiac vein, cardiac vein. No more this. This is, you see, coronary artery This is right coronary. This is arterius. What you see, this is this posterior vein of left ventricle and other. I end lecture. Thank you for attention. Goodbye, students. Goodbye.